day passes by in Nigeria without the story of symptoms. Symptoms of people living with infections that are becoming harder and harder to treat. From the anti-malarial drugs we take at the slightest perception of any fever, to the recommendations from concerned neighbors to visit roadside chemists to buy medication without a prescription, the overuse and misuse of medications are now widespread. Gradually, these symptoms evolve from a minor pain, fever, cough, cold, boil, or sore to full-blown infections and untreatable wounds. Then, where these overused and abused medications no longer work, healthcare costs increase significantly due to prolonged hospital admissions and higher costs to treat these difficult infections. This is the journey of antimicrobial resistance, a slow and silent problem, yet one of the top 10 public health threats facing our world today. It happens when an antimicrobial drug, which will typically cure infections by killing the harmful microorganisms that cause them, no longer works because the microorganisms have become resistant to the drug. According to a study published by Lancet in 2019, infections caused by drug resistance are responsible for about 4.95 million deaths worldwide. As more and more antimicrobial drugs become ineffective due to misuse and abuse, developing new ones to kill these resistant microorganisms will cost a fortune. And if no action is taken, antimicrobial resistance is projected to become the leading cause of death worldwide by 2050, causing 10 million deaths every year and up to $100 trillion in losses to the global economy. This is why Dr. Ameyo Stella Adadevoh Health Trust (DRASA), in commitment to Nigeria's action plan on antimicrobial resistance, flung into action to scale an AMR school program, which involved establishing health and hygiene clubs in secondary schools, designing an AMR curriculum, and conducting club activities with school students, a portion of the population on whom the dreams and future of our nation depend on.
DRASA is a public health non-profit organization based here in Nigeria, and our mission is to protect public health. And really what that means is ensuring that we are prepared for health emergencies like infectious disease outbreaks. We know that these types of health emergencies are very costly. They, not just in terms of the loss of life associated with them, but also the economic impacts that they have on nations, which can take years to recover from. And so we are committed as an organization to building resilience and strengthening the health sector at every level to prepare for and manage these types of emergencies. And we do that in two ways. The first is that we are building a nationwide network of health champions, and these are people who are in schools, hospitals and health facilities. They're in communities, they're at the points of entry and borders around the country, and their role is really to prepare for and identify these types of health emergencies and contain them so that they don't spread and cause preventable damage. And the second way that we protect public health across the country is working directly with the government. And that is in the line of helping them develop policies, emergency plans, and giving technical guidance on how to be prepared for different health emergencies that could occur.
6 years ago, because of our passion for putting an end to antimicrobial resistance, we began the #ItStartsWithMe program to emphasize how one person's action can influence their health and the health of those around them. DRASA wanted more people to know more about AMR and widespread misuse and abuse of antimicrobials in Nigeria and how to prevent themselves from getting infected with these resistant microorganisms. Students in secondary schools were our main concern because they are young, vibrant minds who are not just easy to teach and nurture to pick up healthy habits that prevent AMR, but can also influence others to learn and stick with these healthy habits. We call these students our DRASA ambassadors for AMR.
So the AMR school program is currently being implemented in 30 schools in Nigeria, and we have 20 of these 30 schools here in Lagos and the remaining 10 schools in Osun State. So in Lagos State, we have our reach in 2 major districts, districts 4 and 6, and we have 10 schools from district 4, 10 schools from district 6. In Osun State, we also have our reach in 2 major districts, Osun East District and Osun Central District, with 5 schools each. In terms of what this project is really about, we hope that by the end of the project, we would have raised about 900 antimicrobial resistance ambassadors, or should I say AMR stewards, who would take the message of what we've been teaching them about AMR to their communities, to their peers, and hopefully would have a ripple effect in the knowledge application and also the use of antimicrobials.
I've learned a lot of things. I've learned things about personal hygiene, I've learned different types of germs, and I've learned how to cook myself too.
I've learned so many things in DRASA Health and Hygiene Club, and it has been interesting being an ambassador. The introductory class was somehow fun because the topics were things that we've learned, but we were open to some facts that we didn't pay much attention to. Part of those facts were like hand washing, and it wasn't as if we were just taught about hand washing as an health fact, and revealing fact about hand washing was that only water can't wash away our germs, so we have to add soap to be able to clean those germs together. So I've learned so many things about health tips in DRASA Health and Hygiene Club, from hand washing to antimicrobial resistance to sexual and reproductive system, and so many things.
I've learned quite a lot of things as a DRASA ambassador, like hand washing, their importance, personal hygiene, menstrual hygiene, and even and most especially antimicrobial resistance.
As we have expanded our AMR work in schools since 2018, we knew we needed to do things a little different for these new 900 ambassadors.
So the first phase, or the first time we did this program, it was more focused on the health and hygiene aspect. This time around, we've taken a much more comprehensive and broader approach to AMR. We've incorporated elements of One Health, and we've also tied every single message, every single lesson back to the global challenge of AMR, which right now is what they're calling the silent pandemic, one of the biggest health emergencies that the world is facing.
So we know that to effectively manage a group of students, or should I say adolescents, it's better for you to keep it at 30 students per teacher, and in this case per youth trainer. So what we have done is that in each of our 30 schools, we ensured that the maximum number of students who can become our ambassadors are just 30. And to actually get that number, we streamlined attendance, or should I say being able to be a member of the club, to just senior secondary school 1 and senior secondary school 2 students. So that's just SS1 and SS2 in these public senior secondary schools in the 2 states. The reason we didn't choose SS3 students is because from our experience, we know that SS3 students will be very busy with WAEC, that's West African Senior School Certificate Examination, and so their commitments to the club might not be 100%. So we're focusing on these SS1 and SS2 students who are not necessarily prefects, but students who are enthusiastic, students who are perhaps leaders, maybe class captains, or even students who are like very enthusiastic about health. Yes, so we made it very free and fair, such that the teachers wouldn't just put their best students in the club. We wanted it to be very representative, and that's what we've done, across all 30 schools.
We chose to establish these health and hygiene clubs in public secondary schools because they have a greater need than most private schools and often lack functional hygiene facilities such as hand washing stations, toilet, and sick bays. To equip these 900 ambassadors of AMR, DRASA trained and deployed 15 passionate youth trainers with relevant experiences who held bi-weekly meetings in these 30 schools.
I love my team, and I would say that the success of this project is strongly hinged on the shoulders of the members of the team. So for the management level, we have a program management team, and we are just 4. Myself being the program manager, then there's a project coordinator for Osun State, there's a project officer for Lagos State who also does as our monitoring and evaluation officer, and then we also have a data analyst. Then for those who actually do the work, we go to the schools to engage with our ambassadors. We have 15 of them. So we have 10 youth trainers in Lagos State, and we have 5 youth trainers in Osun State. In terms of who they are, the team is so diverse. We have microbiologists, we have sexual reproductive health advocates, we have dentists, we have people who are public health and social workers, we have people who were once teachers or who have had this kind of experience with engaging adolescents and secondary school students. So it's a very, very diverse thing. We have veterinarians, and I think it's bringing all that diversity into the classroom and teaching AMR is one thing that I really love about what we are doing with the project.
These youth trainers engage the ambassadors on topics like germ transmission, hand washing, personal hygiene, environmental sanitation, antimicrobial resistance, responsible use of antimicrobials, sexual and reproductive health, antimicrobial resistance, and sexually transmitted diseases. For some of these youth trainers, it was solely about the desire to see young adolescents get a good head start.
Well, I chose to be a youth trainer for this program because, one, I looked at the hall and I realized that I have the necessary skill sets, the experience and expertise to deliver on this program. Also, I looked at the passion I have for young people, especially ensuring that they have access to improved healthcare delivery. And this program is one in which young people, high school adolescents, will have access to health education. And I know that with health education comes behavioral change and all. So it's just got the interest in me to put in an application and hope that I will come on the program. Most important one I would say was when the youth trainer, when the DRASA ambassadors at Faculty Comprehensive High School came to me after a particular lesson, it was a lesson on hand washing, that they would like to teach other students what they had just learned. It was very interesting at the time because they had internalized the lessons and then on their own came to meet me to speak with the focal teacher and the admin to facilitate that engagement on the assembly ground. And while I came here to capture the moment when they had the assembly presentation, I was not a part of their preparation, I was not a part of their reactor, I just came to record and I saw the students, they had internalized the lesson, they delivered expertly, they communicated their colleagues in their own language, using their own design, their own strategies, and it was expertly done. So it gave me so much joy that these students are committed, they are interested, and they are assimilating, they are learning, maximally, they are getting the very best benefit from the program. And that was one major highlight for me. Another one I would say was when the same students gave me a gift at the end of the program during our lesson 10. They gave me a gift to appreciate my inputs and contributions to the program. It was very emotional for me because this was something I was employed to do. But then they still felt that I gave my very best, and it actually encouraged me to give my best going forward on any program or project I come on.
I would say I enjoyed teaching them about menstrual health and hygiene. I enjoyed that lesson was because I actually had a lot of fun. So for example, I can remember when I was asking them what kind of sanitary materials they use with regards to menstrual hygiene. Somebody mentioned Ankara clothes, so things like that. Going back to what I said, it does basically emphasize the for more health education.
I use things like games to take icebreakers, so it gets to cheer them up and yes, become lively after that.
This story is not so different from that of other youth trainers who are passionate about the topics in our curriculum.
It has to be lesson 5, the Super Gem Comics, because after that we got responses from other people in the school that they wanted to join, and because the way the students put in their best, they were able to express their talents and they were able to communicate with one another very well.
Then that will be club meeting 5, and that is designing their Super Gem comic. So it was gave them an opportunity to actually show their creative side.
I think the ambassadors enjoyed the lesson on antimicrobial resistance because it had very interesting activities. There they had to do the catcher game, they had to do the Super Gem comic presentation on the assembly ground, they had to do group presentations, they had to interact, brainstorm, come up with innovative ideas of what super gems are. So they really enjoyed that more, and even from the engagement, I can comfortably say that antimicrobial resistance was the lesson they enjoyed more.
As with past ambassadors who have honed their creative skills through our clubs, we always find ways to structure our lessons so that students can actively participate and are fully involved in these lessons. For some of the students, it was a first-of-a-kind experience.
I want to have learned about ANR because I've not seen a place where they educate people about ANR. I only saw the meaning in dictionary, but the only meaning there didn't expose me to much thing about it. But when I joined DRASA Health Club, I was educated a lot about it and I really understand a lot about it now.
For others, it was an opportunity to work together to do something fun. Most importantly, they had many memorable moments that allowed them to work together in groups and solve problems. For most of them, the experience through our clubs have made them more knowledgeable, more confident, and improved their hygiene habit. And they do not want to keep it to themselves. Some share the work they have done with their fellow students. Others share with their fellow students, friends, and family members at home.
Well, it is a true saying that wherever anything that is of great quality is, other people desire to emulate it. So it is of no doubt that people are trying to get into the club, and it is also of no doubt that people are getting benefits, and because they are getting benefits, it is their utmost desire that they also get to be a part of DRASA International Club.
Like my mom, for instance, before she cooks, she does not really wash the vegetable like normal. But when I got home, I told her about DRASA and I told her that there are germs in her vegetable. And I told her that she needs to soak the vegetable in water, for example, like lettuce, for 3 minutes before cooking it. And she picked up that habit.
And there were even more aha moments for these ambassadors.
How to wash the hand and the techniques to follow, and the 6 important areas to be washed, which are the palm to palm, the knuckles, the tips of the fingers, and the in-between of the fingers. And this can be washed with water and soap.
So when I told them about how important it was, they were very happy and decided that they will start washing their hands from that moment. One of the most important things I've gained is antimicrobial resistance. I learned that if we take drugs when we don't need them, it won't work for us when we need them the most.
It was also fulfilling to know that our club activities have inspired these ambassadors to consider certain career paths in the future. So, to ensure that we help our ambassadors immediately implement what they have learned in their schools, we donated hand hygiene materials to the schools in commemoration of World Hand Hygiene Day. We donated Veronica bucket and water bucket, soap and hand sanitizers to each of the 30 schools in Lagos and Osun State. We established relationships and received the active support of the teachers and school administrators who provided us the access we needed to the schools and students to align our bi-weekly lessons with their school's timetable.
Many a time these students, they go to the toilet without washing their, after leaving the toilet, they will not wash their hands. But now, they do wash their hands, because there was a day I saw a student. He was going towards the gate, and I asked him, "Where are you going?" He said, "Mommy, I want to go and fetch water. That I went to the toilet, and I need to wash my hand. In fact, I need to clap for him." I did. I clapped for him. At least he has that knowledge, that intelligence that he needs to wash his hand after leaving the toilet.
Personally, I interact with them on a very, very close scale. And when you look at their entire lifestyle, their perception and understanding of what DRASA actually targets, before and now, there's a great deal of difference. Every one of the ambassadors, you can see the excitement, you can see the joy, you can see the enthusiasm by which they express the club and even tell others. So there's a great difference, and I think I want to say kudos to the focal person, Adeola. She, the way she handled the club in the school, she did it in a way that she carried the students along, and we are so much grateful. There's a great change. Their understanding, you'll be surprised, some of them are hard students, but their understanding of all this, the virus, keeping their body hygiene and every other thing, is a very big plus. There's a difference. Say no. This kind of, we have had lots of programs, like I said earlier on, but this type of the focus of DRASA, we have had none like this in this school. And so we are very, very happy having the program kickstarting in our school. It's a privilege. We are so happy.
This program has never happened in our school before, and I was the one that inaugurated this club, Health and Hygiene Club. I inaugurated Integrity Club. I inaugurated ICPC Club. There are some clubs that were in this school before those ones were inaugurated. You understand what I'm saying? But now that this club is inaugurated, I can say that there are noticed changes in the school. Changes in the sense that we have environmental committee in the school, yet Health and Hygiene Club, they still join them, especially those selected students. They still join them to carry out the environmental work, to make sure that the hygiene in the school is perfect, to make sure that the environment are healthy environment. The students they have really done well. And apart from that, there are some students that will come. Okay, mommy, I'm feeling ill today. I'm feeling ill. I'm not okay. Those ones, they have stopped. They have stopped.
Overall, DRASA's impact through the health and hygiene clubs has resulted in 161% increase in knowledge of our ambassadors on AMR and improved their understanding of what to do to promote health and prevent diseases. This is because our learning method includes creative activities to make sure ambassadors take ownership of their responsibility to live healthy lives and demonstrate their knowledge to influence and improve the behaviors of others in their circles of influence. One of these unforgettable moments was the Super Jam comic character activity, where ambassadors were put into groups to brainstorm, create, and illustrate harmful microorganisms called super gems that are resistant to drugs. The ambassadors used their innovativeness to name these characters, describe how they multiply and spread, what makes them harmful, and how to avoid getting infected by them. Our 900 ambassadors worked in groups to illustrate over 100 comic characters to help share the awareness message on AMR far beyond the health and hygiene clubs. We want a Nigeria where young people are part of the change we desire in our health sector, and we have been consistent with making this happen over the years, one ambassador at a time. Some of our past ambassadors who have benefited from the club have shown good understanding of AMR and are passionate about putting an end to this threat.
Okay, so I think I'm just going to do like a highlight of, everything. So the activities, the group activities they were really amazing. So I remember when I led an activity which most other students were not totally interested in. So I kind of dragged a fellow ambassador along with me to go onto the assembly ground to talk to the students about, germs and viruses. We had already made like viruses we drew on cardboards and stuff like that. So we went to the assembly ground to talk to the students about viruses, about bacteria, and that was one of the times where I know that I was pushed out of like my comfort zone. I stood on the assembly ground, I addressed the students, and to my greatest surprise, students were interested in listening to what I was saying, and it was really interesting. So that is one experience that I know has stuck to my head. And aside from that, it has, in the real world today now, it has pushed me to try to go out there to get things that I want for myself. And yeah, it was amazing. And then relating with other ambassadors as well, because we had people from different departments in school back then. We come together, we discuss about health. We got to know areas where one was not strong in, and then someone else would share their own experience and their own knowledge, and we could learn from each other. So that experience was really amazing, sharing knowledge and learning from every one of the ambassadors. So that was great.
Every day, the clock ticks on antimicrobial resistance, and we can choose to make a choice. The success of AMR Health and Hygiene School program, which we have now scaled across 30 schools, is just a starting point. We would continue to do more because we do not want the youth in Nigeria and across Africa to be left behind. We do not want the dreams of young, vibrant minds to be caught short by preventable death and diseases.
For next steps, it's all about expansion and scaling. We've already grown from just over 100 youth ambassadors to 320, and now we have 900. And our goal is to exponentially grow this program, take it across the country and definitely across the region, because there's need for this type of engagement of a very important stakeholder, which is the youth, not just for Nigeria, but for all countries across the continent. So I think as a spiral effect of this project, we really see ourselves positioned to support other people to do the same thing. We don't expect to be the owners or sole implementers of this. What we have developed and created in collaboration with WHO is something that can be taken to other locations around the world. And our role would really be that technical guidance and support, being that we have the experience and the on-ground expertise to implement it. So what I would like them to know is the impact and the results. I mean, we can quantify and show the improvements that we've gained in just such a short time with these youth ambassadors. And it's those results that really prove the concept of working with youth as a key stakeholder in the global fight against antimicrobial resistance. And for me, I think it's for partners and donors to see that and to work with us hand in hand to find ways to scale this across the country and across the region and across the world.
And while the clock keeps ticking, we will continue to work tirelessly to ensure that one sound goes through all the continent. Maintain clean and healthy habits. Handle antimicrobial drugs with care, and if symptoms persist after 3 days, consult a health professional and stick to their prescription.